Yes, madam.
A very warm welcome to all of you for this webinar. Chintayascha chitayascha bindu matram visishyate. Chita dahati nirjivam, chinta dahati jivanam. There is only one difference between chinta and chita, that is the bindu. But one burns the dead body, that is the chita. One burns the life or the live body, that is chinta, stress. Then we have to think of this mantra. Om Trayambakam Yajamahe Sugandhi Pushtivardhanam Urvarukamivam Bandhana Mrutyor Mukshiyam Amrutat. Going on to about the topic today. These are the times when a human being is frightened if his body temperature rises. More so when tested positive for COVID. The media and knowledge is not helping much. After suffering the 10 to 14 days and surviving, then recovering, a different stress of post-COVID complications is there. A fear of the side effects of the newer drugs. The natural path of COVID itself causes numbness and fogging in the brain, which we all suffered. Apart from the above, the stress of our power generation engineers who are frontline workers and health workers, many doctors amongst the audience, who continuously work throughout the pandemic, counting the deaths of colleagues under extreme stress. Though NTPC acted like a mother, we needed to handle the stress, for which our faculty is going to help us. Now, about the faculty, respected doctors and the faculty and the administrator from Sunshine Global. He is a member of Indian Psychiatric Society. He has done his degrees from Baroda. Many training programs and achievements are there. Like he presented posters and papers. His interest is mostly in the serotonin dopamine stabilizer. He completed a workshop. Then knowledge and attitudes towards clinical depression among community healthcare providers. Attended workshops on psychosocial intervention in schizophrenia. He presented a paper on exploration of attitudes towards mental health among traditional faith healers in villages of Gujarat. So many feathers to his cap. Now I will request the faculty to take over and continue the presentation. Sir, you are not audible.
Good evening. Am I audible now?
Yes, sir.
Good evening, ma'am. Thank you for your introduction. Good evening to all the esteemed members in this webinar, all the senior faculty members and all the staff and everyone who could join today on this webinar regarding post-COVID stress and fogging. So before we start our presentation, I would just like to highlight the importance of mental health. As we all know that mental health is one of the most ignored aspects of our health, and the COVID just exposed how much we are ignoring our mental health, especially whenever we are dealing with a stressful situation or a challenging situation. So I would say that COVID is actually a blessing in disguise, that we have finally realized the importance of mental health, which especially in countries like India is ignored. India is among the poorest mental health parameter countries in the world when compared with other countries. So today we are going to discuss on this topic, and I am very thankful to Sunshine Global Hospital as well as the NTPC staff for giving me this opportunity. And I will try to share some highlights. It's a big topic, but I will try to keep it as lucid as possible so that you can understand it. As ma'am introduced, I am Dr. Nisarg Shah. I'm a psychiatrist practicing in Surat since 7 years. and I am attached to Sunshine Global via Soch Hospital, which is an institute for mental health and de-addiction. So first of all, we all have to congratulate ourselves. हमें ताली बजानी चाहिए हमारे अपने आप के लिए. क्यों? क्योंकि 3 कारण हैं. मोस्ट इम्पोर्टेंट ही कि हमने एक बहुत बड़ा पेंडेमिक को फाइट किया है और आज हम जिंदा हैं. शायद इस चीज का हम इम्पोर्टेंस नहीं समझते हैं, लेकिन जिन्होंने अपने परिजनों को कोविड में खोया है, those who have lost their family members, they understand the value of life. So we should be proud of it that we have fought the pandemic and alive today. Secondly, while dealing with this, we have become mentally resilient. So what is mentally resilient? वो मैं अभी डिस्कस करूंगा. And third and most important thing is we are all here today, which shows that we are all concerned about our mental health. And we have to understand that mental health is as equal as part of our physical health. Just because we cannot see it or we cannot measure it like our blood pressure or blood sugar, that does not mean that mental health can be ignored. Mental health has to be the most important aspect of our health. Even WHO, that is World Health Organization, celebrated mental health as its theme in 2017 for the World Health Day. So moving forward, let us first understand what is resilience. Now this word you must have heard recently, especially after the pandemic, and it is a new word, but actually it means that it is the ability to recover from or adjust easily to misfortune or change. So it is your inherent capacity, आपकी खुद की एक inbuilt capacity जो when you are facing an adversity like as big as a pandemic that comes and then you are able to face it, that ability is known as resilience. Lekin this is the technical definition. What actually it means. So when I think somebody's mic is on. Yeah. So when we are talking about resilience, what we are trying to say is that when we were facing the pandemic, when we were facing the huge apocalyptic situation in the whole world, we strived to change ourselves and overcome it. So we nurtured a positive view of ourselves. Like जो चीजें हमें पॉजिटिव है हमने उस पर ध्यान दिया. हमने हमारे गोल्स को नहीं छोड़ा है. जैसे मैम ने बोला कि एनटीपीसी का जो स्टाफ था उन्होंने लॉकडाउन में भी काम छोड़ा नहीं है. They were all working, just like the doctors in the hospital, and the policemen and all the sanitary workers. So they were all moving towards their goals. None of them gave up their jobs. They were all doing their work. We made our goals even more stronger. We made new connections. We made new contacts. We faced with it. We took decisive action regarding our work, our society, helping others. We did not just sit back. And we finally also accepted that this COVID is not going to go away. It has come here to be a part of our life. So we have accepted that change. We have imbibed it in ourselves. So when we have done this all together, we can say that we have become resilient. So that is known as resilience, and that is very key for us to understand the post-COVID stress scenario. So by being resilient, we are making ourselves more strong to face such situations if they come in future. When we are talking about post-COVID stress, we are actually talking about two things. As ma'am said in the introduction, first is the stress which we face when we are infected with the COVID infection, when it is inside our body, because the COVID virus is not just affecting the lungs, it is affecting the brain also in many different ways. And when it is affecting the brain, it has its side effects. So that is the worst stress which is because of the infection that affects ourselves. At the same time, when we are affected or our family member is affected, then in the surroundings, others also get affected because of the isolation, because of the strict protocol for testing, because of going to the hospital, because of the family members who have to face the trauma. So that is the stress which we are seeing. The second stress which is there is due to the social, personal, health and economical challenges which we are all now facing after the COVID pandemic. Means it is even after 2 years and 3 waves, because of the huge changes it has brought in our lives. That is the stress which we are seeing. So when we say about post-COVID stress, We are talking in two ways. One is because of the infection, which is to us and our near surroundings, and second because of the change in our whole life, in our work, in our thinking, in our pattern of moving forward, which has affected the whole world. So that is the post-COVID stress which we are talking about, and it is not affecting just one person, it is affecting everyone, irrespective whether living in a very well-developed country, in a westernized country where there is huge economical prosperity, and in a very poor country, even poorer than India. All of them have been affected and have been stressed by the COVID situation. So when we are in the midst of the COVID, which were the symptoms which we are facing, which can we say that it is because of the anxiety or the stress? So the obsessive thoughts about COVID, anxiety over daily activities and our work, whatever we are planning, whether we are able to do it or not, whether we are able to achieve it or not, because of the hopelessness. Even before the vaccine was discovered during the first wave, there was no knowledge whether the vaccine will be a working one, whether it will be able to procure it, who will get it first. Because of the social distancing, there was a lot of isolation when it was even not necessary because of the fear and the paranoia. So isolation from your loved ones, from your family members, even inside the house, and because of the sleep disturbances. So these were all the symptoms which we can say when people were facing because of the COVID, during the times of the COVID waves. Then the COVID storm. Now again, this COVID storm it has two meanings. One is the storm, which is the cytokine storm, which happens in our lungs after the COVID infection. That is a different subject. But what storm which we are talking about is the one which has affected psychological. So the psychological COVID storm which has affected, and it is ongoing. This onslaught is ongoing, we can say, for the last 2 years, because there are multiple waves. In some country, the waves, it is peaking. In some countries, it is going down. It is again going up. So it is an ongoing onslaught on the psychology of the human mind. So the damage which this wave is causing, storm is causing, one is the emotional damage. That is, we are facing emotional damage in the sense that our feelings, our thinking, our attachment with our family members, that is getting affected. Physical damage in the form of health, in the form of our...
दिनेश शर्मा जी, थोड़ा म्यूट करिए ना आपका. Please continue, sir.
Yes, thank you, ma'am. The physical damage which we are facing in the form of our body, whether we are suffering because of the COVID, or we can say that because of the work from home, our body has now been prone to even more diseases because our fitness is going down. So that is a physical damage. Then personal damage. Personal damage means in our relationships, in our goals, in our self betterment, we have faced a lot of issues. In professional damage means people have lost their jobs, their careers have changed, people have changed their job profiles, they are doing something different just to survive. So that is a professional damage. Social damage means because of the social isolation, we are facing relationship issues, we are facing people are separated from their loved ones, and that is causing a disturbance in the relationship. So that is the aftermath of the COVID storm, which we are seeing as far as psychological damage is concerned. So what are the exact symptoms of this stress? When it comes to our mind, what are the exact symptoms that we are facing? So if it is in the body, the symptoms of the stress are frequent headaches without any cause. So there is a headache and then you get your blood pressure measured, but it is normal. Then frequent infections, taut muscles, our body is fatigued. We are having muscular twitches, we are facing a lot of fatigue, skin irritations, breathlessness. So these are all the physical symptoms of the stress which we are seeing. What are the mind symptoms? So there is unnecessary worrying, there is muddled thinking, there is impaired judgment, nightmares, indecisiveness, negativity, hasty decisions. So this is the the mind changes which are seen in patients who are suffering from stress. Then what are the behavior changes? So because of this constant stress on the mind, there is reckless behavior in the form of accident prone, or there is loss of appetite or increase in appetite. There is a loss of sexual drive. There is increase in drinking, increase in taking a lot of addictions, even increase in use of internet or increase in watching web series and all that. So that is a behavioral changing because of the longer isolation which they are facing. There is insomnia because no physical activity does not cause physical exhaustion. So at night they are not able to sleep. So there is a lot of insomnia. There is a lot of restlessness. So these are all the behavioral changes, increase in the addiction, as I told. And what are the emotional changes? So the emotional changes which we see are because of the post-COVID stress. There is loss of confidence. People are facing that whatever work they were able to do before, they are not able to do it because they have not been doing it since a long time. So when they are going back to their jobs, they are lacking confidence, especially the students. I have nowadays a lot of patients as students who are going to the exams, and they are facing this lack of confidence because for 2 years they have not written an exam. So when they are now facing the prospect of writing an exam, they are not able to perform, and there is a less of confidence in them. Then there is more fussiness, there is more irritability, there is a lot of depression and apathy and apprehension. So these are all the symptoms which I mentioned right now that is affecting the body and the mind and the emotions and the behavior. And these all symptoms, there may be some symptoms out of there may be one symptom out of it, or sometimes there may be all the symptoms. But these all symptoms we can say are because of the stress. So that is what post-COVID stress is affecting. It can be because of two causes, as I discussed before. One, because of the primary infection, and second, because of the changes in our environment because of the pandemic. So that is how the post-COVID stress is manifested, and these are all the symptoms of the post-COVID stress. So a lighter moment. What is humor? We all understand that humor is a way of getting relaxed, but in psychology humor is actually a defense mechanism. Now what is defense mechanism? As you may know, that it is a way of coping with stress. So when we are talking about stress, we have to understand defense mechanisms, and in people, sometimes different people have different defense mechanisms to cope with stress. Some people, as we discussed, will start to externalize their stress. So अगर ऑफिस में बहुत प्रेशर है तो घर पे वाइफ पे या बच्चों पे गुस्सा निकालेंगे, या ऑफिस में बहुत प्रेशर है तो बाहर जाके एडिक्शंस करेंगे, स्मोक करेंगे, ड्रिंक करेंगे, like that. So that is externalizing. That way humor is also a defense mechanism, and sometimes when there is increased stress, using humor can actually help you to cope with it. So this is some memes, and memes today are getting a lot of famous. You all know meme is like a joke, and that is a very famous in today's WhatsApp world, where people are forwarding a lot of memes. But I think that meme is a good way of coping with stress, because it helps you to make fun of the situation, but at the same time it helps you to understand that yes, this is something which is causing me stress, but at the same time I cannot do anything about it, so I need to cope with it and move forward. So that is how humor is a good defense mechanism which helps you to deal with stress in your life, and that is one way of how we can cope. So now moving forward, let us discuss about brain fogging. So what is brain fogging? Now brain fogging has been around for a long period of time, but it is just that people are getting to know about it because of COVID, because a lot of people who have suffered from COVID are having some symptoms which technically, actually it is a neurological domain, it is a domain of the neurologist, but people understand that it is because of the mind. So brain fogging is actually a symptom of chronic diseases. Chronic diseases means those diseases which are ongoing for a long period of time, especially which are affecting the brain. So because of these diseases which are long standing, there is confusion, there is decreased clarity of thought and forgetfulness. So there is three things. One is confusion, second is decreased clarity of thought, and third is forgetfulness. So when there is three things, this is considered to be brain fogging. Now in the case of COVID, because of the COVID storm and because of the severe antigen antibody response which is seen in the body, it is affecting the brain also, and that is causing this fogging symptoms which we can see in patients, especially who have been infected by COVID and who have been hospitalized in the ICU or have been isolated for a very long period of time. Then these people can be suffering from brain fogging. So what are the signs of post-COVID brain fog? So first is loss of train of thought, means they are thinking and then suddenly they are lost and they are not able to recollect what was the initial thought. Second is forgetfulness, means they cannot find their own items where they have kept. Third is they are making more mistakes than usual, like silly mistakes which they were not making before. Fourth thing is they are not able to follow conversations, means while they are talking with somebody, suddenly the topic will be lost or they're not able to recall what the some other person is saying. Fifth thing is they have trouble with directions. So if they are going to one place, they are not able to reach. They are forgetting the way. Then they cannot think of words. So they are like they want to tell something, they want to explain something, but they are not able to remember that exact word. What should they use? So that is they are not able to think of particular words. They have trouble learning something new. So they are not able to grasp new things. Their cognition is impaired, and because of the impaired cognition, they are not able to register new things in their memory. They are more forgetful than usual. They are fatigued mentally and physically both. So they are always tired. They are always like, I want to take rest. I don't want to go out, like that. And they are not able to do multitasking. So multitasking is very big struggle for them. So these are the signs of post-COVID brain fog. As I told earlier, it is because of the COVID infection. It is seen in patients who have suffered COVID infection and have been hospitalized. Those patients generally are showing a lot of signs of post-COVID brain fog. Now, as there are many doctors in the audience, they also know that these symptoms are similar to symptoms of dementia. So it is very important to know the history of the patient and to rule out whether it is because of dementia or is it because of post-COVID brain fog. And that is why this post-COVID brain fog is now getting widespread importance, because it is very important to clarify between the two things. So this was my short presentation on what is post-COVID stress and post-COVID brain fog. If you have any questions, you can leave in the comment sections. Now we will move forward to understand how to cope. So as I told earlier that humor is a good defense mechanism of coping. So that is the word cope. What does the word cope means? Cope means when you are facing a adversity or a challenge, we have to deal with it. So that is known as coping. So that when we are facing stress, whether it is post-COVID or is it because of your work or is it because of your family matters or it is because of something external or anything, we have to learn to cope with it. So that is how we can manage it. So these are some tips which we all know, that yes, we have to spend more time with the nature. Yes, we have to pray to God. Yes, we have to pray, practice yoga, practice mindfulness. We have to spend time with friends. We have to do our exercises. We have to eat healthy food. We have to think positive. We have to manage time. We have to read books, practice art. These we all know, but because of our busy schedule, we are not able to follow it. So these are the simple things which actually is easily possible. It does not cost you anything. This is something which you can do it by yourself. But because of our very busy schedules, we are not able to do it. But we have to learn to for this, because if we do this, then we can prevent the stress from increasing. Stress is not the enemy. We have to understand that stress is actually good thing, because it helps you to increase your productivity. It's like a two-edged sword. So if you use it in a proper way, it will be the most beneficial thing for you. But if it is increasing continuously, then you will be buried under it. So it is very important to balance the stress in our life. We have to understand how to cope with it. So these are some skills which we should develop to cope with stress. First is we have to manage our response. So whenever we are facing an adversity, the stress is actually directly equal to what is your response. Like for example, if there is a lot of pressure, if you become irritated or if you become restless, then actually it will cause more harm to you. So when we are facing with stress, the first important thing is we have to manage our response to the stress. We cannot let the stress overcome our minds. The stress is your body's response to something, not something in it or itself, and this makes it easier to identify positive coping strategies. So we have to focus on managing your response to the stress you experience rather than to micromanage the stress itself. So we have to manage ourselves. We cannot manage the stress, but we can manage our reaction to the stress. Like for example, अभी हम कोविड फेस कर रहे हैं, तो कोविड की वजह से हमें जो प्रॉब्लम्स हैं उसको हम नहीं बदल सकते. वी कैन नॉट मेक कोविड गो अवे, but yes, we can vaccinate ourselves so that it does not cause our harm. So that is one way of coping. So that is how we can manage our responses to reduce the stress. Second is time management. We have a lot of things to do, but we are not able to find the time. But there are some people who are able to do it easily. So ऐसा तो है नहीं कि उनके 24 घंटे हमारे 24 घंटे से अलग है. सबके 24 घंटे एक ही होते हैं, लेकिन कुछ लोग उसको अच्छी तरह से मैनेज कर पाते हैं. And what is the reason for that? Because they are able to prioritize. So prioritize, we have to understand that हम सब कुछ नहीं कर सकते. We cannot do everything. We are not superhuman beings. We are normal persons, and that is why time management is important, because we need to prioritize that yes, I will be able to do these things and I cannot do these things. So वो कब आएगा? जब we will understand to learn and say no. We have to learn to say no, because we are not just working, like we are not just professionals. We are a family member, we are a parent, we are a son or a daughter, and we are also a team member. So at every place you are the parent. तो आपको पेरेंट का भी रोल करना है और कमाने का भी रोल करना है. तो वो कब होगा? जब आप बैलेंस करोगे. दोनों चीज में आप परफेक्ट नहीं बन सकते, right? So you have to strike a balance, make your priorities your goals and stick to it. Don't get ambitious too much that I will be the best parent and I will earn the maximum. ये दोनों चीज पॉसिबल नहीं है. तो that is why we have to understand. Fourth is meditation. Different people practice meditation, yoga, mindfulness nowadays is a new concept. So these are all different forms of meditation that is very helpful. Think positive. Yes, we have to stay optimistic and find that what is the most important positive thing and stick to it. We have to forget the negativities and let the past go. If we stick to the past, we will not able to move forward. We have to develop a strong social network. COVID has taught us that the social network is the only support system which we have in this pandemic or in this illness, because they are able to help us when you are in the hospital or at home. We are not having things for ourselves. It is the social network which helps us. So even if the smartphones and the computers have increased, the social network is physical. I'm not talking about the virtual. The physical social network is the most important aspect. Your family members, your siblings, those we need to focus and need our relationships to make even more stronger. We have to meet them frequently. We have to share ourselves, our emotions with them, and make our bonding more strong, because it is also a support system not just to us, but even to our family members, like our children. So that will help them in case we are not there tomorrow. And we have to stay the course. Stay the course means if you have previously used some unhealthy coping methods, like I gave an example, for example, that you are using substances like alcohol or tobacco or smoking or chewing tobacco or using some kind of stimulant, it may help you to overcome the stress for a temporary period. But once you start using it on a daily basis, you will be dependent on it, and then you have to use it more and more and more. I had yesterday only seen a case of a young boy who is in college, and he is addicted to caffeine drinks like Red Bull, and he has started using it during his exam time to stay awake, and now he has to consume almost 3 to 4 Red Bull drinks in a day. That is very bad. So we have to that is something we have to understand, that for coping, if we don't use healthy mechanisms, those coping strategies which actually come back to harm you. So this is how we have to use healthy ways of coping with the stress, and we have to understand that our coping strategies have to change with time. With time, you have to change yourselves. But there are times when you are not able to cope with the stress. There are times where you are just overwhelmed and it has been ongoing for a very long time. It is just keeping you down, down, down. It is affecting your work. आपका वर्क एफिशिएंसी बहुत कम हो गई है. आपका फैमिली मेंबर्स के साथ रिलेशनशिप अफेक्ट हो गया है. यू आर क्राइंग और यू आर हैविंग suicidal thoughts. Then it's time that you have to consult an expert to a psychiatrist and you have to talk with them, because what happens is that, as I told earlier, that mental illnesses cannot be seen physically. They can only be understood by the symptoms. So there are a lot of symptoms which are same in stress and in anxiety, as I will show you in the next slide. So what is the difference between stress and anxiety? Stress is short term. It is in response to a ट्रिगर और अ चैलेंज. फॉर एग्जांपल इन द पेंडेमिक, जब पेंडेमिक पीक पे था तो स्ट्रेस ज्यादा था. अब कोविड नहीं है तो एवरीबडी इज रिलैक्स, बट सम पीपल आर नॉट एबल टू रिलैक्स, एंड बिकॉज इवन इफ द पेंडेमिक हैज गॉन अवे, वो अभी भी एंजाइटी के सिम्टम्स सफर कर रहे हैं. तो वैसे दीज आर द पीपल हु देन नीड टू कंसल्ट एक्सपर्ट. दे नीड टू गो टू द साइकियाट्रिस्ट एंड दे नीड टू टॉक विद देम, सो दैट, because if they don't do, the anxiety will keep on increasing and then it will affect their lives. So this is the difference where we have to understand कि सबको स्ट्रेस है और शायद काफी लोग उससे कोप भी कर लेंगे, लेकिन कुछ लोग कोप नहीं कर पाएंगे, और जब वो कोप नहीं कर पाते हैं और वो स्ट्रेस एंजाइटी में कन्वर्ट हो जाता है, देन इट इज बेटर टू कंसल्ट एन एक्सपर्ट. यू कैन नॉट सेल्फ मैनेज योर एंजाइटी, बिकॉज इफ यू डू इट विल कम बैक एंड हार्म यू, and that is why it needs to be treated, because then it's a disease. If it is a disease, it needs to get it treatment. So these are the some symptoms कि stress और anxiety में symptoms common रहते हैं, लेकिन anxiety में वो symptoms की severity बढ़ जाती है. There is panic attack, there is a sweating, nervousness, tensions, restlessness. So these are all prolonged. वो stress में it is short lived for few days or few weeks and then it goes away, but in anxiety it can be for months and even years. So it is very important that this difference we understand, and if anyone is having any sign of anxiety which they have been facing for a period of time and it is increasing day by day, then it is very important that they should consult an expert about it. So this was my short presentation about COVID stress and brain fog. I have tried to keep it short so that it's not boring, and at the same time I'm able to convey a message to you. Now I am ready to take any questions or any other queries regarding the same.
So one question is there.
It's open now. Kindly be more loud and audible and start your questions, please.
So yes, we have one question. How to differentiate dementia from post-COVID? Yes, this is Dr. Sabde, sir. Yes, sir, this is very important question. And as I discussed earlier, the symptoms of dementia and post-COVID fogging are almost the same. But I think that if you do the memory tests, there are two memory tests. One is the shorter one, that is the mini mental test, MMSC. And the second is the Edenbrook cognitive test. So these are two tests which we generally use in our day-to-day practice. And most of the times with that help of those tests, we are able to differentiate between the dementia and the brain fog. Because in brain fogging, sometimes by pushing the patients, they're able to perform and get a result which is equal to a normal person. But in the case of dementia, it does not happen. So that is how we are able to differentiate, but it is very challenging to do it on a subjective basis. So testing is required. Sometimes we should also do a scan of the brain, the MRI, to rule out any other complication which we will be able to understand why they are having such symptoms.
Somebody is trying to ask question, but we are not able to hear.
Yeah, question. If you can type in the chat box, then it will be better.
If there are no more questions, then I'll request Dr. Chaturvedi sir to say a few words. Dr. Chaturvedi sir, our senior CMO from Vindhyachal, it's a big project, sir. He is dealing with a huge public there. That is supposed to be the power capital of India, with many 3 big projects there. Chaturvedi sir.
Madam, I'm on the way, please. Madam, I'm on the way, please. I'm driving.
Okay, sir. Okay, sir. Then Dr. Sabde sir, he is CMO of Gadarwara. Kindly say a few words, sir.
Yes, thank you, Dr. Dr. Vijaya and the guest faculty from Sunshine Global Hospital. It was a very short, lucid, and very interesting, to the point presentation, and it was really very helpful to everybody, I believe, who has really in a mood to concentrate on what he is telling. And I really appreciate the way he has presented it very nicely.
Thank you, sir.
We are the doctors from all across the NTPC are very much thankful to the organizers as well as the faculty for having such a lucid presentation. Thank you, doctor.
Thank you, sir. Thank you very much.
Perfection need not be achieved. That is very important message today you have given, sir. We need not be perfect. We doctors tend to be perfect. The same way NTPC engineers also. And before saying, I'm really thankful to you and to Mr. Apurva, who has proposed this program. We were suffering. Even I suffered that a few for a brief period. I think I felt like I was drunk. I joined the post-COVID, but I did not know how to. I was losing the train of thought, and all those symptoms were there for me. Then I slowly recovered. Today, that is the reason also why I insisted that this should be, because we doctors treat ourselves badly. And thank you so much. Thank you so much for coming in. And with such a clarity you have given presentation, so nice. And I request Mr. Apurva to say a few words.
Yeah, thank you, ma'am. First of all, I want to wish all of you a very happy World Health Day that has been on 7th of April. And on that occasion only, we have arranged this session. And once again, I want to thank Vijaya ma'am and our faculty Nisarg sir for taking out the time and sharing this type of insights for the betterment of everyone. Thank you so much.
Thank you all CMOs and doctors, senior doctors, specialists of NTPC. And thank you all engineers who have joined here and other officials. I hope this will be useful for you. Stress is there. And as I said, चिता और चिंता के बीच में तो एक शून्य फर्क है. वो शून्य को हमको खत्म करना है to live our life. And after this webinar, we will again meet for another webinar. This is Dr. Vijaya signing off. Thank you.
Thank you, ma'am.
Thank you, everybody.
Thank you so much.